So as you mentioned, we launched Consensus Unite back in 2020. In 2021, we launched jSign, which is our electronic signature product. And our focus with jSign has been, we felt like there was an underserved emphasis on healthcare in the signature market. Certainly there are a number of products out there that do serve it, but we don't think that any of them serve it with a focus on the security and some of the other implementation details that are more relevant in the use cases for the healthcare industry. And I'll give you one example on this really quickly. With jSign, one of the things that we discovered is, and this is something that I think all of us can relate to, when you go into a doctor's office, for your annual checkup, one of the first things they do is hand you a clipboard, and on that clipboard, it's fill out your address, fill out your insurance information. And of course, for most people, this just doesn't change, but you're still filling it out over and over again. When you have a treatment, when you go into the doctors and say, we want to do this treatment, you have to fill out a consent form. All of these things involve a lot of paperwork, which then, as we talked about earlier, has to be rekeyed into the system. And we looked at that and we said, there's a digital signature product that is able to handle these kinds of things, but they're really lacking in that robust ability to collect data, and really even more so, not only to populate that data from a system, say for example, the medical record system that says, here's Bevy's address, here's Bevy's medical information in terms of her insurance and all of that, or here is the procedure that we are prescribing for this patient, and then we merge that into the document, allow them to electronically sign it, and then take that information, which may have been updated by the patient, back into the original system through our APIs. And so we're able to get that information out to the patient to be reviewed and corrected, pulled back in automatically where there are any changes. And of course, we also have that legally binding signatures that are really valuable from the overall process. But again, the benefit here, streamlining the process, keeping it more in the digital domain, keeping it more automated, and making the operations for these offices more efficient so that more of their time is spent seeing patients, getting them treatment, rather than processing paperwork and rekeying information from a printed out form or a handwritten form into their electronic medical record systems where they ultimately live. Our focus, though, is first and foremost on delivering a suite of products, each of which is at or among the best of breed for its purposes. Some of our products have natural places where they connect to each other, and there's a great synergy in being able to integrate those more deeply. Others, it may be two steps along the process. So can they be bundled? Yes, from an economic perspective. Yes, in many circumstances from a product perspective. But I want to avoid this notion of Microsoft Works, if you remember that, which was sort of a word processor, sort of a spreadsheet, sort of a presentation system. We're much more thinking about, kind of this notion of being Microsoft Office, right, which is Word and Excel and PowerPoint, and every one of those stands alone and they're best of breed in their area. That's how we think of our products, as going after best of breed, and their interoperability works better together than they would with other products, but each of those stands alone completely, and together they're even better.